Frozen embryo transfer. What is frozen embryo transfer? A frozen embryo transfer, or FET, is an in vitro fertilization or IVF procedure in which a cryopreserved embryo from a full IVF cycle is thawed and transferred to a uterus. The technique of using a frozen embryo from a prior IVF cycle is known as a frozen embryo transfer or FET. Why choose frozen embryo transfer? You might want to try frozen embryo transfer to help you get pregnant if you have specific health issues or circumstances. You are going for genetic screening or PGT, most common indication. You have chosen an elective procedure. Your doctor thinks that you have a high chance of getting ovarian hyperstimulation syndrome (OHSS) and therefore she wants a frozen embryo transfer. The transfer of fresh embryos has been cancelled due to any medical reason. You would like to have another child. What are the benefits of frozen embryo transfers over a fresh stimulated cycle? Less medication. Most patients are kept on a natural cycle with no medication, and frozen embryo transfer is carried out at the appropriate time. In others, minimal oral estrogen is good enough to prepare her endometrium. Less stress. Patients who use high-quality blastocyst stage frozen embryos have a better chance of a successful FET cycle. With fewer cycle cancellations, cycles are also more predictable. Can be better planned. With the choice of a frozen embryo transfer, an IVF cycle, including pre-implantation genetic testing or PGT or intracytoplasmic sperm injection or ICSI can be better planned. Estrogen levels naturally peak soon before ovulation during the menstrual cycle. Ovulation is triggered by an increase in estrogen, which causes the ovaries to begin releasing progesterone. The endometrial lining of the uterus is then triggered by progesterone. A fertilized egg must be implanted in the endometrial lining and continue to expand in order for a pregnancy to develop. Because the body produces progesterone in response to ovulation, the endometrial lining develops at the appropriate rate to nurture the fertilized egg in ideal circumstances. The optimum environment for implantation is when the progesterone response and endometrial lining development are in sync. The ovaries are stimulated during IVF treatment and estrogen levels peak at significantly higher levels than in normal cycles. Progesterone production is triggered by this artificially generated estrogen peak. Progesterone levels can become too high too soon, causing the endometrial lining to mature too quickly. The possibility of successful implantation is reduced when an embryo and endometrial lining are out of sync. The suppression of progesterone embryo and endometrial lining are out of sync. The suppression of progesterone production is one of the reasons why IVF patients use medicines. However, these drugs may not work in some people and they may still have problems with cycle desynchronization. One technique to avoid desynchronization is to use frozen embryo transfer. Delaying embryo transfer until a later cycle allows your hormones to return to normal before starting, which may improve your chances of becoming pregnant. Embryos are generated and frozen rather than implanted while the body is still healing from IVF. The embryos are frozen and implanted once the body has recovered from the stress of IVF and has returned to a more normal cycle. Embryos are generated, biopsied, tested and frozen during the first cycle. Once the biopsy findings have been received and the female partner has recovered from her egg retrieval, an embryo transfer will be scheduled. Fresh embryo transfer versus frozen embryo transfer in IVF. Fresh embryo transfer takes place during the same IVF cycle as IVF. In the lab, the eggs are extracted and fertilized. the embryos are allowed to mature before being returned to the woman's uterus 3 to 5 days after being removed. Whereas, a woman undergoes IVF, her eggs are extracted and fertilized in the lab, and the resulting embryos are allowed to develop in a frozen embryo transfer cycle. Instead of being transferred back into her uterus on day 5 or 6, the embryos are frozen. Pre-implantation genetic testing can be done on embryos before they are frozen to screen for chromosomal problems. Once these results were received, the transfer would take place. What is the success rate of a frozen embryo transfer in IVF? Freezing techniques like vitrification have evolved significantly in recent years to resemble spontaneous conception, resulting in higher pregnancy and live birth rates, fewer miscarriages, and healthier kids. The new vitrification approach significantly reduces loss rates compared to older slow freezing technology, which delivered few viable embryos. High-grade blastocysts have up to 40% chance of giving an ongoing pregnancy.